Welcome to the complete high blood pressure deep dive. If you've watched our main hypertension breakthrough video, you're ready for comprehensive information covering every aspect of high blood pressure from causes to complete recovery. We'll explore 10 detailed areas with the latest medical research and practical guidance for lasting cardiovascular wellness. Progression and health. Impact without treatment. High blood pressure typically follows a progressive pattern that can significantly impact overall health and quality of life. Initially, symptoms may be subtle or absent and mild in nature, but they often expand to affect cardiovascular, renal, and neurological systems over time. The condition can evolve from asymptomatic elevated readings to symptomatic hypertension that permeates daily functioning and organ health. The cardiovascular health impact extends far beyond elevated numbers, as sustained high blood pressure triggers chronic arterial inflammation and vessel damage. This prolonged pressure activation can contribute to atherosclerosis, left ventricular hypertrophy, and endothelial dysfunction. High blood pressure increases the risk for coronary artery disease, heart failure, and arrhythmias, as well as the risk of stroke, kidney disease, and retinal damage, making early intervention crucial for preventing these complications. However, understanding progression also reveals hope for intervention at any stage. Even long-standing high blood pressure responds well to treatment, and the cardiovascular system's remarkable healing capacity allows for significant improvement regardless of how long symptoms have persisted. Modern treatments can interrupt the progression and often reverse many of the negative impacts, restoring normal vessel function and reducing cardiovascular risk within 3-6 months of beginning appropriate care. Underlying causes and risk factors. High blood pressure results from a complex interplay of genetic, environmental, and lifestyle factors, with no single cause responsible for development. Genetic predisposition plays a significant role, with family history and genetic markers increasing risk by 30-60%, but having risk factors does not guarantee developing the condition. Physiological mechanism differences, particularly involving the renin-angiotensin-aldosterone system, contribute to increased hypertension sensitivity. Environmental factors include high sodium intake, chronic stress, air pollution exposure, and socioeconomic factors. People who have excessive salt consumption, like 5g daily, chronic work stress, or long-term exposure to environmental toxins are more likely to develop high blood pressure. However, many people with these risk factors never develop hypertension, while others with fewer risk factors do, emphasizing the individual nature of the condition. Lifestyle factors encompass physical inactivity, obesity, excessive alcohol consumption, and smoking. Physical health conditions, sleep apnea, kidney disease, and certain medications can also trigger or worsen high blood pressure symptoms. Understanding these multifaceted causes helps eliminate self-blame and emphasizes that high blood pressure is a legitimate medical condition requiring professional treatment and comprehensive lifestyle management. Diagnosis and assessment. Professional diagnosis involves a comprehensive evaluation that considers multiple blood pressure readings, medical history, and cardiovascular risk assessment. Healthcare providers use standardized protocols requiring multiple elevated readings on separate occasions to ensure accurate identification and rule out white coat hypertension. The process typically includes detailed questioning about symptom patterns, family history, lifestyle factors, and impact on daily activities. Physical examinations and laboratory tests help rule out secondary causes that can mimic primary hypertension, such as kidney disease, thyroid disorders, sleep apnea, or medication-induced hypertension. Many people feel relieved during the diagnostic process because it validates their health concerns and provides a clear path forward for treatment. Healthcare providers emphasize the collaborative nature of diagnosis, encouraging patients to openly discuss all symptoms and concerns without fear of judgment. The diagnostic process also identifies any co-occurring conditions like diabetes, high cholesterol, or cardiovascular disease, which affects treatment planning and approach. Modern diagnostic frameworks recognize the complexity of hypertension presentations and focus on overall cardiovascular risk rather than blood pressure numbers alone. This comprehensive approach ensures that treatment addresses all aspects of cardiovascular health and maximizes the likelihood of successful long-term management. My questions to get the best treatment and outcome. Engaging actively with healthcare providers through thoughtful questions ensures optimal treatment outcomes and builds collaborative therapeutic relationships. Essential questions include asking about different treatment options available, expected timelines for blood pressure improvement, and specific criteria for measuring progress. Inquire about combination treatments, such as lifestyle modifications plus medications, and whether newer treatments like lorundrostat or renal denervation might be appropriate for your specific situation. Discuss potential side effects of recommended treatments, strategies for managing them, and what to do if initial treatments don't provide sufficient blood pressure reduction. Ask about lifestyle modifications that can enhance treatment effectiveness, including dietary approaches, exercise recommendations, and stress management techniques. Understanding the provider's experience with your specific type of hypertension and their approach to treatment planning helps build confidence in the therapeutic process. Important questions also include discussing warning signs that would require immediate medical attention, how to properly monitor blood pressure at home, and involving family members in treatment planning. Ask about long-term prognosis, strategies for preventing complications, and transitioning from intensive monitoring to maintenance care. Inquire about the latest treatment advances and whether you might be a candidate for clinical trials or breakthrough therapies. Medications and their effects. Modern high blood pressure medications offer effective blood pressure control with improved safety profiles compared to earlier treatments. First-line medications like ACE inhibitors, ARBs, calcium channel blockers, and thiazide diuretics remain primary treatments, typically requiring 2-4 weeks for full effectiveness while producing fewer side effects than older medications. These medications work by different mechanisms, relaxing blood vessels, reducing fluid retention, or decreasing heart rate to achieve optimal blood pressure control. Newer medications show promise for treatment-resistant hypertension. Lorundrostat induces aldosterone synthesis inhibition and is more targeted in onset, avoiding the potassium elevation concerns that previously deterred many patients from aldosterone receptor blockers. Combination medications may be prescribed for enhanced effectiveness, while longer-term treatments take effect, though these require careful monitoring to prevent hypotension or electrolyte imbalances. Medication effectiveness varies significantly between individuals, often requiring adjustments in dosage or switching between different options to find optimal results. Most people experience substantial improvement within 4-8 weeks of starting appropriate medication. Side effects, when they occur, are typically mild and temporary, including dizziness, fatigue, or dry cough that resolve as the body adjusts to treatment. Holistic and complementary approaches. Integrative treatment approaches combining conventional medicine with evidence-based complementary therapies show enhanced effectiveness for high blood pressure management. Recent studies prove that regular meditation and stress reduction techniques can reduce systolic blood pressure by 5-10 mmHg. Regular aerobic exercise, particularly brisk walking 30 minutes daily, produces powerful cardiovascular benefits by improving vessel elasticity and reducing peripheral resistance. Dietary approaches provide practical tools for managing blood pressure while building long-term cardiovascular health. The DASH diet shows significant benefits for most people, particularly when combined with conventional treatments. Potassium-rich foods, including bananas, spinach, and avocados, support healthy blood pressure regulation and may enhance treatment effectiveness. Mind-body approaches have proven incredibly effective in providing stress management tools that people often need for sustainable blood pressure control. These approaches recognize that healing encompasses the whole person, not just symptom reduction. The combination of traditional medications and complementary treatments often produces better outcomes than either approach alone, offering multiple pathways to cardiovascular wellness and long-term health maintenance. OTC items that can be of help. Several over-the-counter supplements and products can provide supportive benefits for high blood pressure management when used alongside professional treatment. Magnesium supplements help support healthy blood vessel function, particularly beneficial for people experiencing muscle tension or sleep difficulties. Potassium supplements support electrolyte balance and may reduce sodium-related blood pressure elevation associated with high salt intake. Omega-3 fatty acids show promise for cardiovascular protection through anti-inflammatory mechanisms. Research suggests that CoQ10 supplements play a direct role in cellular energy production and cardiovascular health, supporting the use of targeted nutritional interventions. Garlic extract has mild blood pressure lowering effects for some people, though these should be discussed with healthcare providers to avoid interactions with prescription medications. Home blood pressure monitors can provide immediate feedback during lifestyle modifications and medication adjustments. These supportive measures work best as part of comprehensive treatment plans rather than standalone solutions. Self-help strategies. Empowering self-help strategies provide immediate tools for managing high blood pressure while building long-term cardiovascular resilience and health skills. Deep breathing exercises and progressive muscle relaxation quickly reduce acute stress responses and can be used anywhere blood pressure spikes occur. Meditation and mindfulness techniques help identify and address anxiety patterns that often accompany elevated blood pressure. Cognitive behavioral techniques include stress reframing and time management that bring sustained blood pressure benefits. Creating structured daily routines provides stability and predictability that reduces cortisol elevation and supports healthy circadian rhythms. Regular sleep hygiene and consistent meal timing support overall cardiovascular regulation. Gradual exercise progression helps overcome sedentary patterns that maintain elevated blood pressure. Keeping blood pressure logs helps identify triggers and successful lifestyle strategies. Building social connections and maintaining enjoyable physical activities prevent isolation and provide natural stress relief. These strategies complement professional treatment and provide sustainable tools for long-term blood pressure management. Supporting loved ones. Supporting someone with high blood pressure requires understanding, patience, and knowledge about effective approaches that truly help rather than inadvertently increasing stress or resistance. Listen without judgment and avoid minimizing their health concerns, as this dismisses their experience and can increase anxiety about their condition. Instead, acknowledge their commitment to health improvement and ask how you can best provide support during treatment adjustments. Learn about their specific dietary needs and medication schedules, and respect their need for lifestyle accommodations while encouraging gradual progress rather than dramatic overnight changes. Offer practical support like preparing heart-healthy meals, joining them for walks, or helping with medication organization. Encourage professional treatment while avoiding becoming their primary health monitor or trying to manage their blood pressure for them. Maintain your own well-being and set healthy boundaries to prevent caregiver burnout or enabling dependent patterns. Support groups for family members and friends of people with cardiovascular conditions provide valuable resources and connection with others in similar situations. Celebrate blood pressure improvements and healthy lifestyle victories, understanding that management is often ongoing with ups and downs. Prevention strategies. Building cardiovascular resilience and implementing prevention strategies can significantly reduce high blood pressure risk and prevent complications in people with previous episodes. Regular cardiovascular exercise creates a foundation for healthy blood vessel function and efficient heart pumping. Developing healthy stress management skills early helps people navigate life challenges without developing chronic hypertension. Maintaining ideal body weight provides natural protection against the metabolic factors that can trigger high blood pressure. Learning to identify and address high-sodium foods, excessive alcohol consumption, and tobacco use before they become entrenched prevents the development of pressure-elevating lifestyle patterns. Regular health screenings and blood pressure monitoring help prevent progression to more severe hypertension stages. Early intervention during young adulthood, when lifestyle patterns are forming, can prevent progression to clinical hypertension. Education about cardiovascular health helps people recognize early warning signs and seek help promptly. Building social support networks enhances stress resilience and reduces isolation that contributes to poor health outcomes. These prevention strategies benefit everyone, regardless of family history, by promoting overall cardiovascular wellness and longevity. Universal sources, template medical and scientific references, Cleveland Clinic, lorundrostat Phase 2, B Clinical Trial Breakthrough, 2025, Queen Mary University, London, Targeted Thermal Therapy and Zilebesiran Research, 2024 to 2025. FDA, Renal Denervation Procedure Approval and Safety Guidelines, 2024 to 2025. American Heart Association, Cardia, One Study and Intensive Blood Pressure Control Trials, 2024 to 2025. World Health Organization, Global Hypertension, Prevalence and Treatment Guidelines, 2024. Centers for Disease Control, U.S. Hypertension Control Statistics and Trends, 2024. New England Journal of Medicine, Aldosterone Synthase Inhibitor Research, 2025. The Lancet, Fabulous Study in Global Hypertension Epidemiology, 2024 to 2025. American College of Cardiology, Latest Evidence-Based Treatment Protocols, 2024 to 2025. Analysis and Content Development, Medical Research Synthesis, Content Structuring, and Evidence-Based Information Compilation. This content is for educational purposes only and does not constitute medical advice. Always consult qualified healthcare professionals for diagnosis and treatment of high blood pressure. Subscribe now to join thousands getting reliable health information that improves lives, as knowledge is your best medicine, and we hope you've gained valuable insights from this video series. Make sure to subscribe and like this video. It helps us create even more valuable health tips for you and others. Don't forget to share with anyone who would find this useful. Also, please comment below with any questions or topics you'd like us to cover next. Stay informed, stay healthy,